Hi there. My name is LB Schulman. I'm the author of young adult books, including Stolen Secrets. But I'm here today not to talk about my books. I'm here today to hopefully inspire you to go out and sign up to give blood. What if I were to tell you that all of you sitting here listening to me right now, if you all went out and signed up and gave blood tomorrow, that some of you in 2 weeks would find out that you are a super donor. What's a super donor? That means that not only do you save 3 lives with your blood donation, but you also can save the lives directly for COVID-19 patients in the ICU at this very moment. How does that happen? Well, before I go into all that, let me take a step back and just review some basics of blood donation. First of all, the blood bank only takes 1 pint of your blood. You have 10 pints inside of you. On top of that, whatever red blood cells they take out of you is regenerated mostly within 24 hours, and everything is back to normal. So why am I talking about giving blood right now? Well, that's because there's some hot off the press news that I have to share with you. I've been speaking to Vitalant.org to get the story straight for this speech because I want you to have only the facts. The first thing you need to know is that every 3 seconds, somebody in the United States needs blood. The blood banks are responsible for collecting, believe it's 32,000 pints of blood per day in order to meet the medical needs for Americans. A lot of blood. And fortunately, during times of crisis such as this, people are very eager to help out and they sign up. But there's a problem. The problem is COVID-19 requires that people stay apart from each other. That means the blood mobiles no longer can work. There's just no way to make it work and social distance accurately. So blood banks have to come up with new locations temporarily that they can use for their blood drives, big locations. I, for one, am going to be donating in 8 days at Marin Catholic High School. It's going to be a safe experience because all of us are going to be 6 feet apart. I'll be wearing my mask. The workers from Vitalant will be wearing their masks. In fact, even before I walk through the door, I'm going to have my temperature taken to see if I'm showing any signs of COVID-19 so that I don't happen to accidentally infect anybody else in the room. It's a very safe process. But because Vitalant they have a lot of people who want to sign up to give blood, but they have to keep that 6 feet social distancing. As you can see, their numbers are probably much lower than normal. And this is a real struggle. On top of that, getting back to the news flash, Vitalant has just announced that they will be testing for COVID-19 antibodies. This is huge. It's huge for you personally because wouldn't it be nice to know, especially down the road as they find out more and more about how antibodies help with immunity from perhaps future cases, and you could potentially go back to work and you could potentially live your life more normally. We don't know yet, but it'd be great to know. Second of all, Vitalant has promised they will let you know either way. 2 weeks after you give blood, you'll find out a yes or you'll find out a no. Let's say it is yes. Then you are very lucky. And the first thing Vitalant is going to do is they're going to send you a cape and a pair of shorts that are just too small. No, just kidding there. Maybe they won't send that. But what they will send is a special notification to you asking you to take a quick COVID-19 test. It's a drive-through experience at the local testing place. I have one right down the street from me. Quick, easy, and if you're not symptomatic, the odds are very likely you are now testing negative for COVID, at which point you can donate your antibodies through Vitalant to help people in ICU. How does this work? Your antibodies go into their body and basically help their immune system reinvent itself and boost itself and help them get better quicker. There's a lot of cutting edge research going on right now, and Vitalant and I'm sure some other organizations are also behind researching blood's benefits in this sort of situation. Now, it's a good thing that COVID-19 is not a blood-borne illness. So there is no chance that even if you had an active case of COVID that you would infect someone else, because it just doesn't travel that way. It's airborne. The one thing that I want to say to you is that while you can save the neighbor down the street who maybe just gave birth and had something go wrong and needs a transfusion, or someone else on the other side of the street who took an elective surgery and just had some bad luck there, the number one way your blood is used to help people, even if you don't have COVID antibodies, is with cancer patients that have gone into chemo. Why is this? Well, chemo basically tamps down your immune system. That's the whole point, is it tamps it down enough so that your body can fight the cancer. But that also causes a drop in your red blood cell level that can be dangerous. And if it does get to dangerously low levels, that person's going to need your blood. We've all known somebody who has cancer. And we've all known somebody who's gone through chemo. I give blood for selfish reasons as well. I give blood because I want to help other people, but I also am depending on other people to be there if I need them. I don't want to be gloom and doom here, but I feel fairly sure we're going to have a second wave of coronavirus in the fall. And in that situation, I'm really hoping that people will continue to give blood, and people with antibodies will continue especially to give blood, because the blood that you give today only lasts 42 days. So that's why the blood bank really depends and really hopes that people will step up and be able to possibly even give blood 3 times a year. You don't know what's going to happen to you if there is a second wave, and I don't know what's going to happen to me. So let's help each other out. Give blood today. Get your free antibody test. No need to go to Quest Diagnostics and pay $120. And let's all help each other out. It's costing Vitalant $10 for each person to run this test for free for you and me. This is out of their own pocket. That means one simple blood drive in one simple community is probably costing them $600, $700. They're doing their part. Let's you and me do our part to help our community.